Well, welcome everyone to Steve Savant's Money, the name of the game. I'm your host, Steve Savant, syndicated financial columnist and money color commentator. On today's show, how to enroll in Medicare, part 3 in our series on Maximizing Medicare with author, speaker, and nationally recognized Medicare expert, attorney Sylvia Gordon. Welcome to the show, Sylvia.
Thank you.
Sylvia, I know that you are an expert. We have people watching this show today. They know about it, it's coming, they see it in their mailbox, but they don't know how to enroll. I want to know, how do I do this? Why do I need to obey the law? I mean, there's a lot of moving parts here. Walk me through why I'm doing this. How do I do it?
Okay, so the first thing is, who are you? If you're already on Social Security, then that's a different person than a person that's going to continue to work for their employer to 70, 75. So let's talk about the average person that wants to retire at 65. They're not already on Medicare. They don't have Social Security. They can go online and apply, and it's relatively simple. They will then get a confirmation code, keep that, and they'll get their card in about 3 to 4 weeks. Now, don't trust the government. If it doesn't come in 3 to 4 weeks, something's wrong. Start calling your local office, try to figure out. Don't just say, well, it might be 6, 7, 8 weeks. Don't trust them, okay? Once you get your card, now everything's cool. You don't have to wait to get your card before you can start talking to your advisor about what supplemental insurance you are going to choose, because that's a big decision and that'll take you several months. So a lot of times you come to the advisor and say, hey, I turned 65 in 2 weeks and my Medicare is automatically going to start. No, it's not. You have to apply, and then we can apply for your supplemental insurance.
Can I ask you a question? How soon do I, because you just told, you're scaring me on the bureaucracy issues.
I know.
So how soon do I have to do this? I don't want any break in coverage. So am I doing this 3 months before I turn 60? I mean, I'm kind of afraid now because of the way you just said, hey, there could be some delays here.
So let's say my microphone is my birthday. My birthday is January 15th. So I have 3 months before my birthday, I have the month of my birthday, and 3 months after. If I get past that window, now I get into penalty. The penalties are big and they last forever. Okay, so most people want to sign up 3 months beforehand so that they got everything in a row, especially if there's delays. Okay, so 3 months before my birthday. Now, if my birthday's on the 1st of the month, then I move everything up an extra month. So it's 3 months, it's 4 months before my birthday because I happen to have that birthday on the 1st of the month. So the rule of thumb is 3 months beforehand, you want to be in the system and you want to already be making your decisions. So when your birth month comes, your Medicare starts on the first day of the month. It's not going to start on the 15th, it starts on the first day of that month.
You just said the new to the Savant. If I'm born the 1st, and how far into the month? You know, because you just said I might have to go earlier, a 4th month before my birthday month. So how far is it? The 1st? Everybody born from the 1st to the 10th?
No, just the 1st of the month.
Oh, just the 1st. So if you're just happen to be a child of the 1st of the month, you got a 4-month period in the front end, and you need to use it. That's what I'm hearing.
Right.
Okay. Now, you know, what am I getting here? You know, everybody's excited about it. I've heard you say on many of your videos on YouTube, you said you're excited. This is a great insurance. Coming from, you know, most of the people that are doing ACA and other places, this looks like nirvana.
It is. It's really good insurance. And when I talk about all the problems that you can encounter with the bureaucracy, it's worth it for the quality of insurance that you get. It's really good insurance. In most cases, it's much better than anything you had privately or from your employer. Really rich employer group plans are like a thing of the past. So people are really excited when they get on Medicare. Now, sometimes they have the misconception that it's free because they took that out of your paycheck the whole time you're working. That was for Part A, and that is paid up, and that is free. But you will sign up for Part B, and that's what we're talking about, signing up for Medicare, signing up for Part B. If you take Part A, if you take Social Security early, you already have Part A. Now, get confused the subject a little bit, but if you have Part A, you're not allowed to continue to contribute to your health savings account. You have an HSA. And people get themselves in an inadvertent tax trap because they didn't know that. And not only that, but remember when I said if your birthday's right here, that your window's 3 months before? For Part A, you can't continue to contribute to an HSA 6 months before Part A. Nobody knows that.
Nobody knows.
So then your accountant, depending on the time of the year, your accountant might be able to back that out for you. But if you straddle 2 tax years, then you might be stuck with an inadvertent tax penalty by contributing to your HSA when you weren't allowed to. That's another whole video just on HSAs. We're going to go into that next. Right. So I want to just talk right now about how to sign up for Medicare, when, and why. Okay. So you want to sign up for your Part B. You can't get any supplemental insurance unless you have B. Because people, they know about D. They really want D. They want to get their drug coverage. But you can't sign up for a Medicare Advantage unless you have A and B. You can't sign up for a Medicare supplement unless you have A and B.
When I'm enrolling, you put the fear of God in me now. So
I know, your face is getting a little white.
I'm done, but I'm thinking about all my baby boomer brethren. We're all in this boat together. If you're below 65, this should be one of your impetuses to motivate you.
Right, is to sit down with somebody that specializes in Medicare. Don't sit down with the guy that handles your home and your auto, the jack of all trades, because he will not know this.
But they could call you. They could contact you.
They can call me. We have a huge staff. We have thousands of agents. If you ask in the comments, we can find an agent close to you, or you can work with our call center agents, or you can email me personally in the comments. I'll be happy to help you. What are you getting when you sign up for Medicare? What is Medicare? Okay, so Part A that they took out of your paycheck the whole time you were working, that's everything in a hospital. So that's inpatient care. That's also hospice, nursing home care, and for limited home health care. But and stuff in the hospital. What is Part B? Outside of the hospital. So doctor visits, labs, x-rays, if you need oxygen, if you need a wheelchair, stuff outside of the doctor's office. So Medicare A and B together, that's called Original Medicare. And that's what will be on your card. So here's the new Medicare card, which will have your name, will have your unique number, which they just changed those in 2019. For the past 52 years, that was your Social Security number, unless you were a railroad retiree. So now that is a random letters and numbers. So we're tackling all of the identity theft, identity fraud that was resulting from that. Then it shows your Part A date, the day it started, and your Part B date and the day it started. For people that retire at 65 that weren't taking Social Security early, those dates are going to be the same day. And your insurance agent will need those dates to sign you up for your supplemental insurance.
Okay, now I've got my A and B. I know you just told me what I'm getting. And it's picking up, it picks up a tab. You said in an earlier video that I watched, you were saying that in some states with some Medigap or supplemental insurance, that there may not be a premium to that. So what are you trading off for that? Okay,
that's another whole subject way beyond the scope of this. There's no quick answer to that. For Medicare Advantage, we have other videos. I have hundreds of videos about Medicare Advantage. Okay,
so if I'm enrolled in A and B, I'm ready to meet with my agent for supplement.
Right. For supplemental coverage, which could be either Medicare Advantage, which could be as low as $0 monthly premium, or a Medicare supplement, and to start doing your Part D. So let's back up a little bit for getting your Medicare supplement. If you continue to work past 65, past my microphone date, and then you decided, oh, I do want to retire after all. I kept working because I wanted to get that bonus at 66, and now I'm out. Now you have to go face-to-face into your local Social Security office, because they will need 2 forms. They will need the late Part B enrollment form, or not the late Part B, but the Part B enrollment form. And they will need a letter signed by your employer proving that you had credible coverage so that you're not late and you're not going to be getting a penalty. So now this is the tricky part, getting that appointment. Now, it used to be, I'd say, you can just walk in, go early, don't go on a Monday or Friday, don't go at the end of the month, and just go in there and wait. Well, there's so many people retiring now. There's 11,000 a day, especially in your sunshine states, Florida, Arizona, Texas, California. You need an appointment, and it could take you months to get an appointment. Now we're looking at a penalty because you can't get in to sign up, and that's on you because you waited too long. So just because you didn't want to retire until here, you need to start planning months in advance. Talk to a specialist. Because if you do get a late Part B enrollment penalty, it's a big one, and it's forever. It's every month for the rest of your life.
I'm astonished that we don't know these things, and even as a planner myself, I mean, so these are the nuances of the code that could really hurt a client.
Right.
Wow, I'm flabbergasted by it. Okay, so let's just say I actually obeyed everything you did. I went to the bureaucracy meeting. I waited. I got in there just in time. I didn't pay the penalty. I have my card. I'm ready to go. Now, when I have my Part A and my Part B, I know what I've got. I know what I have in enrollment. Do they send me anything that says this covers this covers that? I mean, how do I know to engage with Medicare? How do I do it?
And that is the weirdest thing, is that I get people that have been on Medicare for several years, and they're like, oh, I didn't know I could get supplemental insurance. That's crazy. How do you know? You will get a Medicare and You guide every year from the government, and it's really a good guide. As much as the government stuff is hard, if not impossible to read, it's really well written and easy to read. I read it from cover to cover, and I highlight it, you know. And yes, I'm a trained specialist in insurance, but I'm looking at it like just from a layperson, and it's readable. Not that everybody wants to. You know, I don't want to read the manual on how to work my car either. If you don't want to read it, talk to your specialist, your insurance agent that can help you go through the changes every year. But you will get a copy of it every year from Medicare. It's going to be in your box.
Okay. Listen, don't forget to watch our next segment on health savings accounts and Medicare, part 4 in our series on Maximizing Medicare. And keep in mind, before moving forward with any of the ideas on our show, always check with your tax consultant, legal counsel, or your financial advisor. You're watching Steve Savant's Money, the name of the game.